Most of the procedures that we do here do not involve any big incisions compared to before, which is a very big open heart procedure. I'm Dr. Eric Oliver Season. I am an adult interventional cardiologist at the Perpetual Health Medical Center, Heart and Vascular Institute. The cardiac CATHLAB, or the cardiac catheterization laboratory, is a specialized operating room, as you can see here, where we can perform specialized cardiovascular or neurovascular procedures. Especially for cardio, you have your coronary angiogram or your angioplasties, pacemakers. We can also do that. We can also do other vascular intervention like procedures regarding the blood vessels on the legs or on the neck or other parts of the body. We have a specialized operating table and radiologic equipment where we can visualize the necessary blood vessels as we do these procedures. Cardiac cath lab is a specialized procedure room where we can do cardiovascular procedures. The more common ones, yung tinatawag na coronary angiogram or coronary angioplasty. Ito yung mga procedures na kinakailangan ng mga pasyente na mayroong mga chest pain or nakakaramdam ng hingal o kakaroon ng atake sa puso. I-visualize or tinitignan yung mga ugat sa puso. Kung mayroong bara, we can also open it up by doing angioplasty so we can restore yung blood flow and hopefully save the patient's lives. There are other specialized procedures that we can still do, like pacemaker implantation or even replacement of some of your faulty valves in the heart that can be done percutaneously here in the cath lab. I am very proud of this new cardiac catheterization laboratory here in Perpetual. We actually have two state-of-the-art cardiac catheterization laboratories. This particular lab is the first installation of its kind here in the Philippines. We have the latest technology that we can use for better outcomes for the patient. A little bit more technical, but I can mention we have intravascular imaging, we have coronary physiology, which are accepted as part of the modern armamentarium in treatment of cardiovascular diseases. Another strength of this cath lab, of course, is the people who are working here. Good cath lab is not complete without the qualified interventional cardiologists. Our nursing and radiologic staff are also very experienced and excellent. May puso sa pag-aalaga ng pasyente. We are able to do most of the cardiovascular procedures that are being done in the country. The Perpetual Heart and Vascular Institute offers a comprehensive in state-of-the-art services for our patients, beginning from prevention, diagnosis, intervention, and even rehabilitation of their cardiovascular illness. So before mag-undergo invasive procedures here in the cardiac cath lab, the patient is of course evaluated by a clinician, a cardiologist, or a neurologist who will do some tests necessary before we do interventional procedures. Symptoms like chest pain or shortness of breath. And we will do first non-invasive testing like 2D echo or stress test to see if there is a need for them to undergo a more specialized testing like coronary angiogram and then probably an angioplasty. The same thing for neurovascular or neurological conditions. They'll be seen by a neurologist. They might be presenting with symptoms of stroke, and they will undergo first a CT scan, and then they will be assessed if they will need intervention here in the cath lab. What sets apart the cardiac cath lab is we do primarily percutaneous procedure or less invasive procedures. Most of the procedures that we do here do not involve any big incisions. Usually when we say percutaneous, it is just through a small needle hole, and we're able to put in the tools, the catheters that we need for us to do the job that we need to do. Compared to before, where the patient will have to undergo coronary artery bypass, which is a very big open heart procedure. The same goes for neurovascular interventions that can be done percutaneously. Of course, the major advantage is that the recovery time of the patient will be much shorter because there's only 1 or 2 puncture sites. And of course, the safety, the risk of complications is also very much less. Para po sa ating mga pasyente, kung kayo po ay may mga nararamdaman, lalo na sa dibdib o sa puso, maaari po kayong kumonsulta dito sa Perpetual Health Medical Center. Meron po tayong mga qualified na specialist doctors who can assess you, who can diagnose your illness, and we have state-of-the-art facilities here in Perpetual where you can receive modern diagnostic and therapeutic interventions like here in the Perpetual CATHLAB. Maalagaan po kayo ng mahusay at ng mas mura.